According to the class. Hey, all right. Thank you all so much for coming today. I am super excited to have some wonderful people back that I haven't seen in far too long, and also to meet some new people. So, we'll get started. You guys all kind of do different things in medicine, so I'm excited to hear your different journeys. So basically, what we're going to do is I'm just going to go through, ask a question, and then I'll kind of pick on one of you to start us out, and then we'll round robin through, and then we'll come to the next question. So Bethany, I'll start with you. If you want to tell us your name, your job title, how long you've been in your current position, and then what degrees you currently hold or are working on.
So I'm Bethany Davis. I'm a family medicine physician and went to actually UCSD for undergrad. So hi, Allie. And I have been a board certified family medicine physician for 8 years. And then obviously lots of education before that. I've done multiple things within that. So I've been faculty for residencies and medical schools and now I just have a private practice. So I'm just doing my own thing, which is nice. And I have an MD.
What was your original undergraduate degree in?
Physiology and neuroscience.
Okay, awesome.
Yeah.
Awesome. Thank you so much. Anna, do you want to follow up?
Yeah, sure. My name's Anna. I'm an associate scientist at MD Anderson Cancer Center in Houston, Texas. And I'm on more of the research side. So I'm part of a drug discovery division that is looking, my particular group works on generating small molecule drugs to treat cancer and neurodegenerative diseases. And I have a bachelor's in biochemistry.
Wonderful. Thank you. Emily?
Yeah, so my name is Emily. I am a research associate and field researcher at UCSD's Health and School of Medicine. Um, so we do translational research, so similar to Anna, but we focus a lot with people and how to help specifically women living with HIV engage with their healthcare through providing them support with ancillary services like social support, healthcare, mental health, things like that to see if it helps to improve their healthcare. So I have my bachelor's degree in biology.
Wonderful. Awesome. All right. Emily, do you want to tell us, did you start your academic journey knowing what you wanted to end up doing, or did you pivot? And if you pivoted, what did you pivot away from and why?
Yeah, I think I pivoted a little bit. Originally, I was interested in going into genetic counseling, because that was really the only career that I knew that would let me engage with a lab in a research setting while still interacting with a patient population. But when I saw a job opening that let me do the exact same thing, in a new world, I had just finished working on research in my undergrad. So I was excited to continue research in a new lab as a career. So I pivoted towards this just because it was an available opportunity and kind of fell in love with it. And it'll do this for a long time, most likely. So yeah, I pivoted in short.
Yeah, I love that. I love that. I think it's more common than students think, especially when they're at the beginning of their journey. They think you have to figure it out first. No. Awesome. Bethany?
I pivoted, but my pivot was kind of early in my academic career, but late in my age. So I went to undergrad up in Seattle for a couple of years, right when I was, I think, 18. And I had no idea what I wanted to do. And I did fine in school, but I was just not interested in not knowing what I was doing there. So I left, I dropped out and did a whole lot of traveling and opening a business and moving around, and then went back to San Diego City College for a single anatomy and physiology course at one point in time. And halfway through that course, I was like, oh, I'm supposed to be a doctor. And then just kind of dug in from there. But, I graduated UCSD when I was 30. Yep, I think I had just turned 30. And I started medical school at 31. So yeah, it was a big pivot in my life in general. Once I knew what I wanted, I went for it, but it took a minute for sure.
I love that part of the journey too, because I think people think, I don't know how anyone knows what they want to do when they're 18.
Me
Um,
neither.
yeah, they took a long time for me to figure it out. So, and I've taught students that I'm like, wow, you're so driven. It's amazing. But I think it's good to know that not everybody starts that way, and that's okay too. So yeah, awesome.
Absolutely.
All right, Anna.
Yeah, I definitely went into college thinking that I was going to go into medicine, like directly treating patients, become a doctor of some kind, but I didn't know what specifically I was interested in that field. And so sort of along the course of pursuing a medical career, I everyone said you should get into a research lab. You should get into a research lab. And so I did. And fortunately, one of my scholarship programs provided a stipend that made that an opportunity for me to focus on that alone instead of having to work at the same time. So that was really helpful. But I did end up pivoting as well, away from medical career and more into the research side. When one of the grad students in that lab told me, you can help people in research too. You don't have to go into medicine if you want to help people. So then it really kind of opened my eyes to like looking for what are the other ways that I can help people. And turns out I love research, I love science. So that was a great way that I could improve my community as well as do something that I loved.
Awesome. I love that. Um, one of the other things too that I just want to drop in as a subtle hint for our students is when you go in a research direction too, if you do end up going on to graduate school, it's paid for. So that's a nice bonus. It's not having to pay your way through your graduate work. No offense, Bethany, but but yeah, the price tag is helpful too. So awesome. So I muted myself. Anna, did you want to tell us what drew you to medicine? So it sounds like that's kind of where you started.
Yeah. It's where I started. Mostly because of it's personal. I have known multiple family members and friends of family who have had cancer, who have either passed away or undergone a lot of hardship facing it. So, I always wanted to be part of that fight.
I love that. Awesome. Emily, did you want to follow up?
Yeah, I think as all medicine-minded folks do, Anna touched on it. I just wanted to help in a capacity and wanted to help in a way that suited my strengths. And I knew that I liked science. And so the field of medicine was obviously appealing in that sense. But I began volunteering with the Trevor Project and helping out in their counseling services, and found that I really enjoyed the counseling aspect and being able to work with people through kind of these mental health crises or mental health support. And through that began to dig my heels in on kind of holistic medicine and wraparound services, and what are syndemics and these things that overlap to contribute to somebody's healthcare, aside from solely their doctor's visits or their medication routine or their physical health, like housing or mental health or food. Um, So being able to engage with all of those spheres and try to support people in all of those ways, both directly with medicine and these indirect ways, was something I felt like I had seen lacking in medicine a lot, and excited to start bridging that gap a little bit.
That's wonderful. I love the I do this may be an uninformed question, but I feel like that's almost like a public health type of direction, right? You're
Yes. Hmm.
so the research that you're doing is more around understanding the big picture, those
Right.
other little things, um, which is I think can be more intuitive for people that are less engaged by the pure scientific research and more about understanding bigger picture things.
Right. Yeah,
Yeah,
exactly. It's a great way to put it.
yeah, awesome. All right, Bethany.
I think similarly, medicine's a space where I get to just connect with people in an ongoing way. So family medicine was always my draw. I never wanted to do one of those specialties where you see someone once and never again. And so much like Emily, the bridge between science and humanity, I love science, I love math, and I love the human body, and it's such a miracle, and all of the things about learning those parts of things, and then also being able to integrate it with who a person is in their history and their belief systems and their physical health and what they think is going to help them, and kind of just pulling all that together is what drew me to medicine, that whole human connection.
I love that. And this is kind of off book, but I don't know if you feel comfortable answering this, but now that you have your own practice, are there things about working independently versus working in a clinic or for a hospital that obviously the independent part is nice, but what drew you to having your own practice and how are the challenges differing, basically?
That what drew me to my own practice is getting out of the system. So, as you may or may not know, our medical system is a little bit broken and leaves a lot to be desired for a lot of people, particularly the underserved population. Um, and so, the space for me to talk to people about alternative medicines, anything that's in line with what they feel would work for them and not just what a doctor is going to shake their finger and say, quit smoking, do it, which doesn't work anyway. So having those ongoing conversations in a way which feels really unmonitored. So I can spend however much time I want to with a patient because it's my clinic. And if someone would be served better from a referral to acupuncture than they would to a referral to a allergist, then I have those conversations with them. Yeah, I mean, I think just the freedom to practice medicine in a wider space, in a more open and accepting space with more time.
What allowed you to make that transition? Because
Oh,
obviously, if everybody could do it, then everybody would do it, right?
right. I mean, honestly, probably idiocy allowed me to do it because it's been an uphill climb. Building your own clinic is a really financially challenging thing, and I do accept insurance, so I have to go through all of the red tape and fight through all of those things. And potentially, if I knew how hard it was going to be, I maybe wouldn't have done it. But it's I don't know, kind of like medical school and residency. If I had known how challenging it was, I maybe wouldn't have chosen it ahead of time. But on the back end, having gone through it and come out the other side and being able to do what I do now, I wouldn't go back and not do it. It's really powerful and gratifying and uplifting. Yeah.
I get that. I get that. And I that's kind of what I was expecting the answer to be, but I'd much rather let you speak for it. But yeah, no, the healthcare system I can imagine is really, really challenging, especially when you're working in a very prescribed kind of environment, which I think a lot of hospitals or insurance groups or whatever are, right?
Yeah.
So so being able to give individualized care and also being able to build relationships with people the way that you want, I imagine is very gratifying, but I'm sure incredibly challenging also. So we wouldn't have it any other way, right?
Oh, I
The
don't know. I
harder
could do with less challenge,
way.
but
I
sure.
think I think that, but then I keep doing the things that are really challenging. So,
Yeah. Yeah,
I don't know. I don't
exactly.
know. All right. Well, thank you for going off on that tangent with me. I
Yeah.
appreciate it. Okay. So, Bethany, what resources helped you move from degree to career?
Well, I think honestly, age probably helped me. Like my own, I've been through it, I've been there, I've done that. I've done lots of experimenting with life and people, and I understand, I knew what I wanted at that point in time. It wasn't going through high school and then having no idea how I related to the world, if that makes sense. And so when I got done with residency, I knew I wanted to be in a small mountain town where I could raise my kids and I could be outside all the time. And so I basically just cold called places where I wanted to be. And I said, hey, do you want to hire me? And worked out.
Wow, that's amazing. That's really interesting. I like
Yeah.
that.
So, yeah. So I think it's different for different people,
Sure.
the draw.
Awesome. Emily.
Yeah, I'm a little on, I guess, the opposite side as Bethany. I graduated recently with my degree about a year ago. But something that people told me that I didn't totally get was the importance of this well-rounded person. So yes, it was very important to be knowledgeable in the hard sciences and understand biology and lab and research, but it was just as important to learn empathy and build the human connection with participants or patients, work as a team and communicate. And what does that mean in today's world and in the virtual setting? Um, so being able to capitalize on kind of all of those things, not just the degree, has been a pleasant surprise, but one that I didn't fully anticipate, especially moving into a research world.
Wonderful. Thank you. Anna?
Yeah, so for me, it sounds a little too simple, but literally, it was networking. And networking is such a necessary evil. It's uncomfortable. You have to make small talk. But somebody that I had job shadowed in high school remembered me, and I kept up correspondence with him, and he ended up getting me my first job, which was not my current job. It was with a small biotech company down here in Houston. And so after graduating, I just took advantage of that right away, because that's not an opportunity that always comes up very easily or very quickly. Got some experience, and then transitioning from that job into my current job, we ended up renting out time on an instrument in my current lab. And so my connection with the person who trained us on that instrument is what flagged my resume as an option for them to interview when I did end up applying. So network, 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 network.
Yes, truer words. Yes, I as every aspect of my life, including the panelists that are in this Zoom room with us. Yeah, I'm always drawing on those networks, and there's no part of my career that has not been touched by people that I've met along the way. So yeah, absolutely. You mentioned something that I think is helpful for people to hear, which is that there's sometimes a gap between when you graduate and when you get employment. And I think that you kind of feel like once you get the degree that it's just like, okay, here's the job. Like I'm done now, I did it. And that's not always the case. And so that can be challenging as well. So, you know, keeping in touch with those networks and being mindful of those next steps is one of the easiest ways to make that transition smooth. So yeah, beautiful. All right, we're flying through. All right, Anna, do you want to talk about a typical workday in your field?
Sure. Yeah. So I am pretty fortunate. I get to work pretty independently. My lab is a bit different than your typical academic lab. It's kind of this mix between academia and industry, underneath a larger hospital institution. And so we have different subgroups within our division that focus on specific things. So my group is in vitro pharmacology. So I do sometimes cell assays. I'll do assay development in plates, really high throughput assays, in order to screen the compounds that our medicinal chemistry group makes. And from there, it'll pass on to other groups, including our IMPK group, our in vivo group as well. We also have a translational biology group too. So it's a very collaborative atmosphere. My day usually it may involve project team meetings. We have multiple projects going on at a time, and I'm on two right now. And if I'm not in a meeting, fortunately, I don't have too many of those. Unlike some of our leaders in this group, they are always in meetings. But then I'll have lab time. I'll usually come in, I'll check my email, I'll plan out my experiments for the day, go in and do them, analyze data as it comes in, release reports, that kind of thing. So it ends up being a lot of communication, but also a fair amount of lab time too.
Awesome, thank you. Emily.
Yeah, every day is a new adventure, it feels like, in participant facing research. Um, Most of my days are spent directly interacting with participants. So, as part of their participation, we follow up with them, or we have their initial setting or meeting with us, or their study visit, where we go through all of their informed consent, make sure everything's appropriate, fully enroll them in the study, and then go through about a 60 to 120-minute guided survey with them about lived experiences, experiences that they've had with their healthcare, specifically HIV, but also socially, what support's available to them, what their mental health looks like in their current situations. Um, Very thorough, long Zoom surveys with participants. And then we have the same survey every 4 months to track their progress and see if our peer support and clinical interventionist is helping them in which areas are growing and so on. So a lot of my time is spent talking with participants about their lived experiences and things like that. Just as much time is spent with recruitment, engaging with community organizations, networking and building partnerships to help support women find resources for them that in whatever they need across the state of California. I spend a lot of time helping to write operating procedures or SOPs, working on different community activity boards throughout the state, working with them to again promote our study, help find resources, a little bit of everything. But yeah, that's mostly what I do on a day to day.
Do you work at all on the grant side of things or?
A little bit. So our principal investigator is heavy on our grant writing. So I'll help her when we need extra funding or more grant writing, different opportunities. We'll work together to use our preliminary findings to determine what next studies will be. Um, start bridging different gaps. So if it's peer support models, if it's nationwide access instead of just throughout the state. I know we've spoken a lot about building apps and social networking sites specifically for women or women living with HIV or who have been affected by it. A lot of connections with interpersonal violence, support systems, things like that. So yeah, policy, grant writing, all of that, all of that fun stuff.
And do you tend to work in an office or remotely?
It's all, I'll go into the office about half the time. So I'm hybrid working, but when I'm meeting with participants, everything is completely virtually. So today I'm able to work from home. Tomorrow I'll go in and do a little bit more of the administrative and team collaborative work. So it's a good mix.
Awesome. Yeah, I think that kind of flexibility is really nice too, especially if you're planning on having a family, right?
Right.
You know, it's nice to be able to have a little bit of flexibility in when you're in the office and when you're not. So
Yeah, definitely.
wonderful. Bethany.
My my day changes all the time, so it depends on who's coming in to see me. I spend probably a third of my time just managing the business of the clinic, but oftentimes that's after we're closed. And then it's just really kind of handling patients. So I see everybody from newborns to people who are 90. I think my oldest patient right now is 92 or something like that. And so it's whatever shows up. I do some days it's a lot of mental health, and some days it's a lot of, I'll do a vasectomy and then I'll go see 3 siblings, and one of them has autism spectrum disorder. And so managing those resources and giving everyone vaccines, it just kind of depends on what shows up. A lot of chronic care management and a lot of preventive care. Yeah. I mean, I could talk forever on all the things I do, but it's just depends on who shows up and what they need.
Go on, tell us more.
It depends on the age group, depends on what the current guidelines are for labs that I would order, or preventive care management that we should discuss, or and family history. So I talk to some people about genetic screenings and refer people to genetic counselors, and then other people I talk to, it's interesting. I'll get this rash of patients where one person of a certain age, gender, identity will refer the rest of their friends to me after they've seen me. And so I'll have a month where I get back to back, like my age-ish women who are in perimenopause and wanting to talk about how awful that is and what they need for hormone replacement. And then all of the considerations for whether or not they qualify for hormone replacement because of their cancer risks. And it's just kind of going down the rabbit hole of the science and the person in front of me and the risk benefit balance for each thing that we talk about. I think one of my problems with the medical system is that it's overkill. There's a lot of overkill, a lot of over testing, a lot of extra imaging and extra labs and all of those things. So people will come in asking for a thing, and I'll have to sit down and really talk them through, like, what are we going to do with this image that you want? Like, what if the image shows this versus this? Are we going to change anything about your care? Probably not. Then maybe we don't need to do the thing that your friend told you to go get done. And
I, w-
so,
I was
yeah.
I was gonna say I have to imagine in the age of internet resources that probably at least some of what you do on a daily basis is combat misinformation or redirect people to understand what that information means or how to contextualize it for them specifically.
Yep, absolutely.
Yeah.
Yeah, I mean, just talking to people about what a source of information might look like.
Sure.
So people get on the internet, and if they don't have any background in that sort of like sourcing something,
Mm-hmm.
then they're going to believe what they read.
Sure.
And it's like you have to go all the way back to, like, okay, but what is the source of your information, and where do you think that person got their information? And do they have an agenda behind the information they're giving you? And, you know, yeah, kind of getting into the nitty gritty with people about where they're getting what they're getting.
Yeah. Out of curiosity, how much time does it take or do you spend keeping current with things? Because I have to imagine that that's got to be a lot of time to try, or do you do it on a patient by patient basis? So as things arise, then you kind of look more deeply into things or get current with things. Does that make
I
sense?
think, yeah, a lot of both. So I
Yeah.
do a lot of just kind of taking time on my own. And if an article pops up that is relevant to something I see frequently, I'll go read it. And,
Mm-hmm.
you know, I've got lots of sources that send me daily emails.
Okay.
So I ignore 90% of them. And then some of them are like, "Ooh, yeah, that looks interesting." And I'll dig into that piece. Some, you know, there's always continuing medical education. So I spend at least a week a year at a conference, either virtually or in person. And there's the resources of my colleagues. So yeah, a lot of, if someone comes in with something I haven't heard of or haven't heard of in the 8 years since medical school,
Mhm.
or I guess it would be, gosh, 12 years since medical school now, then I'll say, you know what? I don't know anything about the thing you're asking me about, and I'm either going to go find it or I'm going to go talk to someone else who does know. So yeah, lots of education through referral, lots of education through reading, and lots of knowing where my limits are and fessing up to them.
I love that. I think we gain so much by being honest about what we know and what we don't know, and being okay with having to learn still.
Yeah.
So, and I think we teach our patients, you know, mine aren't patients, they're students, but same thing, you know. We're learning together. But yeah, if I don't know something, you know, that's okay. That's fine. Um, beautiful. All right. Um, okay, so Bethany, do you feel accepted by your colleagues and in your profession overall? I don't know, is there a gender gap in family medicine? I imagine just like everywhere else.
I don't know that I could identify a single place where there's not one.
Yeah.
Yeah, unfortunately, I think that's true. Yeah, female physicians are paid on average less than their male counterparts, same specialty, same subspecialty, whatever. I I feel accepted pretty broadly by my colleagues, my peers. You know, sometimes I went to medical school at Washington University in St. Louis, and they are very, very impressed with themselves over there. You know, lots of Nobel Prizes have come out of there. They're very research based, which I love. There's no judgment there. I'm stoked that they do everything they do. And when they would ask me what I was going into and I said family medicine, they would scoff at me. They would say things like, "Why? What are you doing?" You know, just, there was never like, "Oh, yay, I'm so glad you're doing that." So I think environmentally, I've just shifted into a place where I'm amongst my peers that love what I do. And so we lift each other up, and there have definitely been plenty of environments in medicine where no, I have not felt that way. Yeah.
What do you do in those instances, in those times, especially I can imagine in medical school? I mean, that's such a long, intense process. You know, do you just find your people and then insulate, or, you know, what's your
To some
strategy?
degree, you know, you find your people outside of class and outside of rotations, and then inside of rotations, it's a little more challenging. So I had to temper my temper quite a bit, which isn't always easy. And there were some times when I just experienced the downside to being a female in a very male environment, and kind of got shut down a number of times, and, you know, could have fought it harder. I fought it a little bit, and then, you know, when you're working 100-hour week, it's very hard to keep on pressing those issues. And so I think I gave up to some degree, knowing that it was time limited, that I was going to be done with medical school at some point in time and able to be in a different environment.
Pick your battles.
Pick your battles.
All right. Anna, did you want to follow up on that?
Yeah, sure. Um, yeah, I have to say that I also pretty broadly feel accepted. I feel more accepted in my current job than I did in my last job. And I think a lot of that comes down to it being a larger institution and there being, trainings that we all have to do. And it's just generally an atmosphere that, you have to work with a lot of different people. So people have to figure out a way. That being said, I think that my particular lab is really conducive to that. You find your people like Bethany and you said Danica as well, um, and make sure that you find mentors that support you and who you can bounce ideas off of. Check in and be like, am I overreacting, or is this something else that I should take up further? Things like that. My previous job at a biotech was a little bit bizarre in that we had a whole row of associate scientists. So we're junior scientists, and we all sat in the lab. And then those that we reported to, our supervisors, they all sat outside of the lab with this like wall of windows in between so they could see us working. And there were video cameras, and it was just really, really strange. And all of our supervisors were men as well. So it was just, it may not have been intentional, but it was really bad optically, and it made us feel bad. So I didn't stick around there very long. And now that I've worked here for so long, I've worked here about 5 years now. I really feel like it's just a completely different environment. Nobody's breathing down my neck, trying to, make sure that you're working and you're putting all of your lab time in, as long as you get stuff done. Nobody really bothers you. So it becomes more a matter of like when you're a voice in meetings, and you also just sort of have to be confident in yourself and be like, yes, I'm going to sit at the conference table, not in the row of chairs in the back, because I belong at the table too. And you just sort of have to be confident in yourself.
I love that. And I think it's good for people to hear that if you find a place that is not a place that you want to be, um, that there are other places, right? There are other people that may not be true. When you're getting your education, you may be kind of a little bit more stuck where you are, but at least once you get into a career path, right? That you can find a place that feels comfortable and that feels good, right? That doesn't feel micromanaged. There are those places, but they're not all of the places. So yeah, awesome. Emily.
Yeah, it's been I think all women in any STEM field feel the differences and the disparity. Um, Personally working on a project for women's health and women's sexual health and women's mental health. It's very encouraging to be surrounded by other like-minded women and men and folks who have similar priorities and champion similar things in the field. But that being said, working on something as stigmatized and as socially, I guess, uncommon as women living with HIV or AIDS and cisgender women living with different conditions and who have experienced adulthood violence or all different kinds of really, really rough things and have had a lot of stigmatized events happen and have been pushed down so often. It's nice to be in a career and in a setting where women are placed at the head of the table and minorities are given equal voices and if not more, and to be able to champion for those things. So in our little bubble of a lab, it's really nice, but to go out into the big wide world and be the voice for a lot of the women who are not in a space right now where they feel comfortable sharing their voices or advocating for themselves or their conditions. Um, Feels like a lot of responsibility, but similar to what everyone said, to echo all of that, being in a space that allows for that has been so kind and restored so much faith in humanity and the medical world. And um yeah, yeah, I could go on, but that's the summary and the gist.
That's beautiful. I love that. And I think, um, yeah, especially getting into the truly awful relationship that medicine has historically with women, and especially women of color, people of color in general, and the incredible gaps in medical knowledge and understanding um, of how different the physiology is, and how different um, we all are, right? It's and just owning that and building from it um, is is a truly wonderful thing to be able to do. So don't be afraid to go in those directions, right? If you really believe strongly about changing the system, right, there are ways that you can do that, and there's data that needs to be collected, right?
Yeah.
These are spaces that people need to be, right? So
Mhm.
yeah, there's so much to be passionate about and to change in those systems. So yeah, I think that's such an important point, especially for people who are just starting off in medicine, right? That there are so many different ways to help people, right? And I think a lot of people go into medicine for those reasons, hopefully. I don't know that the money is as big of a draw these days. I think there's easier ways to make money than going to medical school. But yeah, there's so much that needs work, and the people that need to do that work need to represent the greater community, right? They need to reflect the greater community, right? So we need more women, more people of color in those spaces to help move the agenda where it needs to be. Beautiful. I like that. All right. Well, we got just a few more minutes to wrap up on any kind of last minute advice. Things that you would advise people who are just starting off in their degree, any recommendations, cautions, or tools? Emily, did you want to start us?
I'd say try a little bit of everything. You never know what's going to stick and what discipline um, is going to resonate with you and what opportunities are out there. So, of course, try the things that you're initially excited about, but don't be afraid to try the courses that seem a little bit more out there, because those are the spaces that you start to pull your niche from, and you get to learn all the different jobs or studies or medicines or styles of the helping profession within medicine. Um, yeah, to try everything and not be afraid of any discipline, really. They're all possible. So
Any tools or anything that really helped you out?
I know we talked a lot about networking, but building the connections with those ahead of you and kind of help building the way for the people coming up behind you makes the world of a difference, even just in the moments where you need a pep talk or a pick me up or, or a good word of his advice, to have somebody who's done it before,
Mhm.
um, and to be able to offer that to people coming up is is special. Um, Aside from the obvious opportunities and doors opening, um, I think a lot of times starting out in a career can feel very lonely.
Mhm.
Um, and it's important to remember that everybody starts at the
Mhm.
beginning, no matter where they're at. Um, and it's okay to ask the questions and try the things and talk to people. Overall, people are good, and people in the medicine world are good people. You just have to seek them out.
Yeah, I think that's great advice too for people who maybe don't have family that are in any kind of STEM area also, which I think is maybe a lot of us or most of us. I don't know. I know there are people out there that know. I never met a scientist until I went to college. You know what I mean? I was like, cool, bike coat, what? So yeah, so just knowing that you can build those networks along the way, like they don't have to be inbuilt. So
Right.
awesome. Thank you. Bethany?
I think a lot of what Emily said is completely accurate. Like connect with those above you, connect with those behind you. Find people who are doing things that make you excited and reach out to them and be part of what they're doing, or at least listen to what they're doing. Take bits and pieces from everything you look at, because there's not one answer and you don't have to do it the same way as anybody else. So figure out which thing from which group is doing something for your heart and soul and follow that and add it into your little pot. And, I think just really figuring out who you are and what brings you joy. I know that sounds super corny, but man, when you are leaning into your future career and leaning into what you're going to be doing forever, even if it's in a different place and shifting labs or hospitals or environments, like it's just so deeply vital to find some sort of gratification, joy, uplifting something. And that doesn't necessarily need to be what other people say is joyous and gratifying. It needs to be what your own soul likes. So I know plenty of people who went into medicine and what they wanted to do was pathology, and they don't want to talk to people, or radiology. They don't really want to talk to the patients. And they get a lot of joy out of like identifying something on a film that would never have been seen if they hadn't seen that film and helped that person. So really just checking in with yourself along the way and finding out what it is that you're loving, I think, is the big thing. And then remembering that you're a whole person in the process and not only doing school or only doing career, but like, I used to go study medicine in line waiting to get into a show with my friend Nate in medical school. Like he and I used to quiz each other waiting to go see Atomic Dog and Dr. Dog, sorry, whatever it was. Anyway, that we like just continuing to feed all the parts of yourself while you're learning is really also a very important piece.
Yes, that's an important piece for all of us all of the time.
All the time.
But yeah, no, when you're in school, especially, you know, especially if there's a class that you don't like, right? And there's gonna be some, right? There's gonna be classes or teachers or just things that you're like, this doesn't do it for me. So yeah, and I think the first piece of advice about learning who you are and what works for you is important in terms of being able to maintain the grit that's needed to get through those classes or those moments in your career development or your education where it's not fun. It's not the thing that really does it for you. So yeah, awesome. Anna?
I couldn't really say it better than both Emily and Bethany. Um, I think just one last little bit I would add to what both of them said is to let go of your need to be perfect. It's really easy to get sucked into this mindset in school for, I won't speak to medicine, but I've heard rumors, so I'm sure it's true. Um, but also in my field as well, you're going to be around a lot of smart people and they're going to know a lot of things that you don't know. And that's awesome. Like we can't know everything in the world, and it's better that everybody can focus on what they can contribute. Or what they can learn from each other, rather than trying to always have the answer. So, yeah.
I love that. I think that was one of the best things about getting into graduate school was finally realizing that that I didn't I didn't feel the need to try and be the smartest person in the room because I knew I couldn't do it anymore. You know what I mean? Like there's just something about you're like, okay, no, this is it. I'm not going to be the smartest person in the room, maybe ever again, and I'm okay with that. So yeah, I don't know if I ever was in the first place, but there's certainly a desire to want to be. So yeah, wonderful. Thank you all so much for your time. I know our students really appreciate this, and I really appreciate having three beautiful, wonderful women here to speak to their experience in medicine. I've had a couple of all-women panels, one of engineers, an entire panel of engineers that were women. It was beautiful. But yeah, so anyways, I really appreciate your time, and thank you so much for sharing your experiences with our students. Um, that's it. So thank you.
Thanks for having me.
Absolutely.
Thank you.
Thank you. Be well.
Thank you.
Bye.